This is a short module on nebulizer treatments brought to you by Educare, and I am Jean Howell, and I will be your facilitator. I'd like to express our appreciation to AgeWell of Minneapolis for their help in the video portion of this module. The objectives will be to state the purpose of a nebulizer treatment, to demonstrate the procedure for administering a NEBS treatment, and to explain the procedure for cleaning the nebulizer equipment. Nebulizers are often used for the very old or the very young. Both elderly and infants are many times unable to use other types of inhalers. These machines are not a drug, but it is a method of administering drugs. It takes a high concentration of the medication and creates an aerosol mist that can be inhaled. This differs from other inhalers, which often use less of the drug, but require more interactivity with the person. By needing more medication in the unit, there is an increased risk in the side effects possible from the drugs themselves. These, of course, vary from person to person, since some use these machines to control COPD, while others use them for asthma. In addition to helping symptoms of COPD and asthma, nebulizer treatments also are effective with allergies, people with heart disease, bronchitis, pneumonia. They are designed for the maintenance of breathing problems, not as a cure for acute symptoms such as in an asthma attack. The medication is delivered in this mist form through a mouthpiece or a mask, and this inhaled medication helps keep the airway open. A nebulizer treatment can last about 10 minutes, sometimes a little longer, but by about 10 minutes, most of the medication has been used up, and you can tell when you're almost coming to the end of the useful medication because there is a different sound, more of a hissing sound when there is not as much moisture to be diffused. Treatments are administered as scheduled according to doctor's orders, or they're delivered on an as-needed basis, or PRN. As with any medication, there are side effects to NEBs. There is the overdosing possibility because they're using a very strong concentration of medication. The vapor mist can irritate a person's mouth and nose and throat. But for patients who are unable to use other inhalers, the quiet breathing of a nebulizer is preferred. And as always, though, we must balance the benefits versus the risks. Now, how do you use one of these nebulizer machines? You want to be sure to place the nebulizer machine or compressor on a level surface. It has a tendency or may vibrate during use, so keep it away from the edge of the table and away from any water. And keep it off the floor to promote good air circulation and to keep the filter clean longer. After you wash your hands and apply gloves, pour a dose of the medication into a small plastic med cup. Seal the cup securely. Then attach the filled cup onto the tubing that is connected to the machine. You want to assist the resident in putting the mouthpiece or mask in place. And if it's a mask, make sure that it fits comfortably yet securely. Then ask him how he's feeling if he is comfortable. And turn on the machine and note the time. Remove your gloves and wash your hands. After each use of the nebulizer, wash your hands and put on the gloves, and you may empty any remaining solution from the med cup. You can just go into the sink and then rinse the cup out with tap water. Let the cup air dry on a clean paper towel. Remove your gloves, wash your hands, and record the treatment where it's appropriate. This is a demonstration now on how to set up and use a nebulizer treatment. First, you're going to wash your hands and apply gloves. And pour a dose of the medication into the small plastic med cup. Make sure that the cup is sealed securely. Next, attach the filled cup onto the tubing that is connected to the machine. Now you're going to assist your resident in putting the mouthpiece or the mask in place. You want to make sure the mask fits comfortably yet securely. Okay, show us the mask. And you want to ask your resident if he is comfortable. Next, you turn on the machine and you want to note the time. Most neb treatments take about 10 minutes, and you'll notice a change in the sound when the medicine is running out. So now 10 minutes has passed, and you return, and it's time to empty out the med cup. So you can take any remaining solution from the med cup and just dispose of it in the sink. And you can rinse the cup with warm water and let it air dry on clean paper towel. And your last step is to record the treatment where it's appropriate. To keep equipment running properly, it's important to take good care of the neb machine and the attachments. This is an expensive piece of equipment. So on a nightly basis, in caring for the nebulizer equipment, wash your hands and put on the gloves. Soak the mouthpiece or mask in a 50-50 solution of vinegar and water for anywhere up to 30 minutes. Rinse thoroughly with cool water, let it dry on paper towel, remove your gloves, wash your hands. And weekly care of the equipment would involve changing the tubing and mouthpiece once a week. Nightly care of the nebulizer equipment is important. So again, you'll wash your hands and put on the gloves. And best practice is to soak the mouthpiece or the mask in a 50-50 solution of vinegar and water for 30 minutes. That's best practice. Rinse it thoroughly with cool water, and again, you can let the pieces dry on paper towel. Remove your gloves and wash your hands. Thank you for participating in this training today. If you have any questions about this material, please be sure to ask your supervisor. And when you are ready, you may take the assessment. A skills demonstration will be scheduled with your nurse.